Thank you, Governor. Good afternoon, everyone. Thank you all for being with us once again. In terms of data for today, we have 107 new cases of COVID-19 to announce. As the Governor has been saying, we have been seeing a plateau in new cases. The yellow line in the graphic that was shown earlier appears to be going up very slightly. That's because that is a graph of cumulative cases. Each day, our number of total cases, understandably, goes up a little. But when you compare our new cases each day, we are absolutely in a plateau. There are 189 people with COVID-19 currently hospitalized in Rhode Island. This number has also been flat or decreasing as of late. We have 44 people currently in the intensive care unit in a hospital, and 30 of those 44 people on a ventilator. Sadly, we have 10 additional COVID-19 associated fatalities to report today. 2 of these people were in their 70s, 2 of these people were in their 80s, and 6 of these people were in their 90s. Our prayers are with the families of these 10 Rhode Islanders. This has been an enormously difficult time for people throughout the state. Many people are dealing with the loss of routines or the loss of work or the inability to visit family and friends. And of course, many people are dealing with the ultimate loss of a loved one. As the Governor has been saying, let's all just try to extend a little kindness, patience, and love to one another right now. With that, there is also the echoing of what the Governor said, where public health is honored to support with kindness those who are peacefully protesting about an important issue. Having your voice heard is fundamental to our democracy. It's also fundamental to public health. So much of what we do at the Rhode Island Department of Health is about partnering with communities so they have a seat at the table and so their voices can be elevated. That's true when it comes to racial justice and addressing racial inequities. And it's true when it comes to policies on housing, transportation, education, employment, and all the underlying factors that significantly impact a community's health and well-being, as we're seeing with COVID-19. This is the important difference for us between public health and health care. Public health and health care are both very important, but public health's broader scope is about addressing all of those factors in our communities that either promote health or that create barriers to healthy living for certain people. In the context of a pandemic, we want to do whatever we can to allow people to participate safely and make their voices heard at peaceful events. Participating safely means wearing a mask, practicing physical distancing, and being aware of the high-touch objects in your environment, and understanding the resources that are available to you, how to monitor yourself for symptoms and to get tested immediately, and where to go, and how to keep track of your contacts and access the resources that we have with the Crush COVID app. We'll make more information and guidance available as it becomes appropriate, but we wanted to make people aware today of our desire to stand in solidarity and to support those who want to safely and responsibly make their voices heard.